I'm Pete Van Branken. I'm a veterinarian from Battle Creek, Michigan. I'm a general practitioner. I'm here today with Gary Landsberg. He's a veterinarian from Toronto. I'm going to let you tell our audience what your advanced degrees are in.
Well, I'm a veterinary behaviorist. I have my certification from the American College of Veterinary Behaviorists and from the European College. I'm in general practice a little bit, but mostly veterinary behavior referral practice, and a lot of writing and speaking and the odd interview like this.
Okay. I have this thing that happens every once in a while in our practice, and I thought I'd ask you about this. We schedule a euthanasia. It's on a 4-year-old Labrador Retriever. Dog's in the office. He looks all right, and the clients, and lots of times it's their first time in our office, and I think that happens every once in a while. People will have a regular veterinarian, and they've gone through, and they don't want to go back to that practice to have their dog euthanized. They bring him into me to have me euthanize him, and then our exam room technicians will take him in the room and put him in there and get everything ready, and then they come out and they start poking me in the arm. They're going to put a perfectly good dog to sleep in there. There's nothing wrong with that dog. I petted him, everything, yada yada yada, and I know there's more to it than this. They're not just very few people nowadays euthanize a pet for no good reason whatsoever. And I don't know exactly how to go about handling this. They want me to talk to them and find out, and I do. I mean, I try to find out what the history on this dog is. But in the same breath, I have some concerns about if I take that dog and talk them out of not euthanizing it. If it's a dog that has like an on and off switch, it's a dangerous dog in their household with them, good 1 minute, bad the next. I think clients really struggle with this, and I don't know what is exactly is a veterinarian's responsibility when you get one of these dogs in the room and you've got the stuff out and you're ready to do it. I don't want to have to entertain questions after the euthanasia is all over. Do you think there was anything else we could have done? I mean, that's a horrible time to have a question like that appear. If you were in my shoes performing one of those procedures today, how would you handle that?
Well, I think you have some responsibility to the pet, no doubt about it, and certainly responsibility to the family, no doubt about it. And if you can help the pet, help the family without euthanizing that pet, and arguably euthanasias for behavioral reasons are probably pretty high on the list for shelters and often high on the list for veterinarians. A study a couple of years ago showed that maybe 250,000 pets euthanized at veterinary clinics were for behavioral reasons. So it happens. The problem is that you also have to balance that against safety. And behaviorists, one of the main things they do, and now we're specifically talking about aggression, and there are other reasons they might be in there. It could be a pet who's messing their house and destroying it, and I'm going to be a little bit more on the pet side in those situations. But when there's safety to the public, safety to the family, safety to the pet itself, then we have to weigh everything that's going on. And veterinary behaviorists do prognosis. We try and determine if there's something that can be done for the pet, if there's something that can be done for the relationship, if the risk is high, if the risk is low. There are many things such as predictability, the type of family, the size of the pet itself, like a big dog versus a small dog. Sometimes breed is a factor. And when you put all that together, sometimes they just need some instructions. Sometimes they just need a different home for that pet, but it's going to work out. And sometimes, unless they're committed to doing it, there is nothing that's going to be done to ensure safety, and therefore we do have to go through that option. But that takes time, so that sometimes you just have to be pretty adamant, refuse to do it right now until they think about it, seek out the options of going to a behaviorist, seek out the options of getting some advice and some history taken from you and your staff. And if you think it can work out, try and give them those options. If not, I guess safety comes first. Now, when you get into other problems like a house soiling pet, a separation anxiety pet, a pet with fears and phobias, some of the other behavior problems, that's sometimes more anxiety of the pet, which we can help perhaps with drugs. It might be a bond issue. It might be an issue where they just don't care for the pet the way they would because the behavior is not what they want it to be. And in those cases where there's no injury or danger factor, if we think there's something we can do for the pet, I think we should be siding on the side of the pet and trying to say, you might not be the right home, you might be the right home, there are things that can be done. A lot of people don't know there are options.
So, but if I explain to that and they know their options and we proceed on with it, I mean, that's always the part I hate, that cold shoulder from my staff after I do that, because I think it takes an awful lot of thought prior to coming into these things. I mean, and they're always putting on a reasonably decent face when they come in. It never lasts very long once we get started on it, and I think. I think this happens to veterinarians almost every. I think it happens to every veterinarian every year, and
it does. But I think that each state practice act gives you different obligations and requirements, and in some cases, once you accept that person as a patient, at least in the province of Ontario where I work, then the client's wishes, if they're the appropriate ones under the circumstances, have to be met. That's why sometimes the screening of these cases, if you don't want to do them, is at the level of reception. In other words, when those phone calls come in, are you a client of our practice? No. Is your pet sick or ill? No. Then this isn't a procedure that we do electively. But if you do want options, please come in and we'll talk to you about your options. I know somebody will eventually do it, but at least morally you can feel a lot better that you didn't. So if it's not something you want to do, I think unless it's your own client, you just don't offer elective euthanasia. If it's something you're willing to do, at least get them in and give them their options.
Yeah, I think I really think the one reason they sometimes will come to us to do this, they want to keep their other veterinarian, but they don't want to have the bad memory going in that hospital.
Oh, for sure.
Yeah. I can think back on my veterinary career. Obviously, we're probably about the same age, and so things are a lot different than when we started, and in a good way. But I do know that, over the years, I can remember clients coming and going, you know what, I got this 12-year-old cat, and I'd be doing the physical on him, and I say, now he's, all of a sudden, the last 6 months or 3 months, he started meowing. And do you know why he's doing that? And this is a behavioral question being presented to a veterinarian. And I do, and he hadn't lost any weight, there's no abdominal tumors, couldn't figure out if I couldn't feel any arthritis or anything. I said, gee whiz, I don't know why he's meowing. In retrospect, since then, I think most of those cats in my practice were hypertension. And we got a Doppler and we started measuring the blood pressures and putting them on amlodipine, and they quit meowing. I think they had blaring headaches. And my question here is, how many things in veterinary medicine today are posed to us as a behavioral problem, which really aren't a behavioral problem, but a medical problem that really have some resolution through medical procedures?
We'll go back to the start of your discussion about when we graduated and how veterinary medicine has changed. And I think one of the biggest ones is the field of veterinary behavior, but not just to treat behavior problems, although that's important, not just to diagnose and save those pets from euthanasia. Another one that's a little bit more subtle is improving the human-animal bond in a family where the people aren't bringing their pet in for euthanasia, but they're not too pleased about the behaviors that are going on at home. And being a veterinarian who asks behavior questions, not only for all the behavioral reasons, but because behavioral signs are sometimes the first signs of medical problems. So that whole field of behavior, not just for helping the pet behaviorally, not just for improving the bond, not just because we have new drugs and medicines to reduce anxiety for the welfare of the pet to improve the problem, but also, number one on the list, you're a veterinarian who has to diagnose medical problems. You don't ask behavioral questions, you're going to miss behavioral diseases. And another big change is the identification, or at least name, that we've given to this problem called cognitive dysfunction syndrome. So that if your cat who was 12 years old and howling wasn't hypertensive and didn't have hyperthyroidism and didn't have renal failure and didn't have ocular or ophthalmic or auditory problems, it could have been cognitive dysfunction. So they all play hand in hand. The answer specifically to your question is every single disease process that I can think of can often start with behavioral signs, and sometimes they only have behavioral signs. Take neurological disease. Sometimes, whether it's a tumor in the brain, whether it's a disease like hepatic encephalopathy, the signs might be behavioral, the way they interact with the owners, howling and vocalizing. Any urinary tract or disease that causes urine flow changes can have a house soiling presentation. A pet who is got a change in personality or temperament in some way. Any of those can be behavioral or medical. Take pain. Pain you diagnose pain, other than gait, almost completely on the way that the pet acts behaviorally. Take sensory decline, cognitive dysfunction, all behavioral signs first. And then we have a whole group of disorders which are self-traumatic, like psychogenic alopecia, I'll use the broad name, or acrylic dermatitis in dogs. And in some studies that both myself and other dermatologists have done, a lot of those had food intolerances. A lot of those have allergic components. Some of them have cleared up simply with medical treatment. See, you've got to ask behavior questions. You've got to think it could be a behavioral problem, but you have to rule out the medical first.
Right. And I think that, and really that's always the problem with us. I think we're trained as scientists.
Yes.
So we're not really trained as behaviorists. So and I think a lot of us probably almost stay away from it for fear that we're going to, for one thing, I think there's a terrific amount of disparity in the information. I mean, somebody tells you to do this, somebody else tells you to do 180 degrees from that. And we're in the medical community, our most of our information, our treatments are kind of down this hallway or down this narrow path, and you can stray a little bit one way and the other. In the behavioral field, there's so many different ways to do things. In fact, there's a lot of controversy. There's probably more controversy. There isn't a whole lot of controversy about how you treat a pancreatitis. There's not a lot of controversy about how you treat flea allergy dermatitis. But when you have behavioral problems, I think there's a lot of controversy.
There's controversy within our profession, different approaches to doing it, and as long as they're humane and positive, we all end up hopefully on the same page. But there's bigger controversy between the lay trainers and the public in general that do things like that. In other words, you go to trainers, you see trainers, and the trainers are either on the positive mode nowadays, or they're on the old kick of choking, pronging, e-collars, etc., punishment, and that's a real problem. So going back to the veterinarian first, at least ask the behavioral questions so you can do your role as a medical veterinarian and rule out medical problems. At least ask the behavioral questions so that you can determine if there's a component that's veterinary behavior. What I mean by that is anxiety, abnormal behavior, unusual behaviors, behaviors that say this doesn't need a trainer, this needs a diagnosis first and maybe some drugs. Ask the questions because cognitive dysfunction and senior brain aging is something that all of these we can sometimes treat, slow, improve with our knowledge as veterinarians. Then you get onto the behavior side where maybe if you have somebody in your practice, technician, because there is a behavioral technician group now, and an academy, a certification for behavioral technicians. Maybe you have your staff trained. Maybe the veterinarians are trained. Maybe you have to refer the case. But know the people you're referring to, because positive training, not dominance, leadership, physical techniques, is not only the best thing to do and the most humane thing to do, but documented to be the way to improve behavior rather than perhaps getting bitten by your pet.
Well, I'm glad you brought this up. I'm currently involved or embroiled in a little controversy between my wife and daughter. We have Dutch Friesians, big. Okay. They're kind of big. They're about the kind of horse you'd see on these jousting things on TV from time to time. They're kind of a small draft horse, and my daughter wants to use the whip to get the horse to do things. And my wife has actually gone through and taken some training classes from one of the popular trainers, learning the more positive reinforcement approach. And they've had some really pretty ugly battles about what's the right way to do it. I agree with my wife. I think that she's, in fact, she's come a long way with the horse. And I know horses aren't your gig, but
the principles are the same.
Principles are the same. That's right.
It's the science of learning.
Right.
Forget terminology, who's got to be the boss, who's got to be the parent, who's got to be the leader. It's the science of learning. It applies to all species. You can be talking about horses, you can be talking about young children, you can be talking about your dog or your cat. You reinforce the behaviors that you want, and you'll get more and more and more of them. It's much quicker and faster sometimes to punish and suppress behaviors, but that stops undesirable. It doesn't train desirable. And there's lots of undesirable that your horse or dog can do, but there's only one way to get it right, or two ways to get it right. So when you choose a trainer, the American professional dog trainers now have certification. Those trainers learn learning principles. They learn science. They learn how to reinforce and shape. Words like clicker training, good sign. Words like reinforcement, good sign. Words like head halters, very good for directing and leading pets. That's the most physical you have to get. Vice versa, words like choke, prong, alpha, pressing to the floor, rollovers, etc. That's confrontational. That could lead to fear and anxiety. That could lead to aggression. A recent study did show that there were more aggression when you used confrontational techniques with an aggressive dog than if you didn't. So it's just the wrong thing to do, even though it might work. And then if you get to the most basic tenet of what we do, the 5 freedoms, one of them is freedom from pain and discomfort. So if you're using a behavioral technique that causes discomfort or pain for your pet, and there is another technique that might take a little longer, a little more work, that is free from pain and discomfort, use that. A good example would be the word negative punishment. Negative punishment is when maybe you're playing with your pet, it's doing something inappropriate, you take the reward away. Great. You're playing with your pet, it nips or bites, you give it a swat, you pin it to the ground. Well, that pet thinks, boy, you're playing pretty rough, or it gets fearful, or it bites back, and you get into real problems when you use positive punishment, because guess what if it doesn't work? You raise the level, and you get more irate, and you get more physical, and you switch to that prong collar, and you switch to worse. What happens when you use negative punishment? You lock the dog up a little bit longer. Right. You back off a little bit longer. You can't get more painful or more
You
intense.
keep stepping it up. You know, you're trumping punishment with, and they're just up in the behavior.
You get used to it, you habituate, you have to raise the level, and it becomes very inhumane. So no punishment in training. Let's get that down pat.
Well, you know, I have this funny thing that's happened over the years, you know, where people say, you know, this is the dumbest dog. And this is on the number 2 DHPP. You know, I had them in when they were 6 weeks, now it's 9 weeks. How's house training going? You know, fair. I just say fair. This is the dumbest dog. You know, and I said, well, tell me what's going on. He said, you know, we go out for a walk, and the dog will urinate, and so I take it back in the house, and as soon as we get in the house, the dog defecates. Well, and I tell people, I said, well, does he like to walk? Oh, he loves to walk. I said, and let me guess, if he defecates outside, then the walk's over with, right? Yeah, the walk's over with. So we have to allow the walk to go on for a little longer, so that you're really punishing the dog by taking him inside after they have a BM. Lots of times, it's cold out here, let's come on in.
That negative punishment again, if they can make the
But they don't even know they're doing it. Yeah, they don't even know they're doing it.
The important thing to realize is, use house training as an example. There's one place you want your pet to eliminate, whether it's a mat, that you're training indoors, or outdoors. That's it. Therefore, you can spend all of your time teaching your dog where not to eliminate through punishment and all kinds of things that don't work, or you can just say, I have to keep taking it out. I have to know a schedule. I have to reinforce it. And one good way to reinforce is with little treats and some positives, but another good way to reinforce, after they eliminate, take them for their walk. Let them play. So the faster they do it, the faster they get play, not the faster they get to go inside. So you're exactly right. It doesn't matter what problem we're talking about. If you can teach the pet the proper way to do it, then you don't have to do anything physical. And unfortunately, some of the most popular TV shows out there are making owners think it's their fault and they have to be more domineering or more alpha or whatever the word. And the answer is, the dogs have the genetics. You have to know the learning principles. Some are a little harder to train than others, but usually you can get where you want to go with rewards.
Now, do you watch this stuff on TV just out of curiosity?
I get upset about it,
Yeah, you know, that's a...
Positive is, I mean, some of these trainers use very positive, what they call energy, confident, consistent. See, owners aren't consistent. At least these trainers are. But when you switch over to that punishment mode, then you're scaring your pet and you're ruining that relationship. So I think a lot of people try to work within their principles instead of understanding normal behavior and understanding learning, and go to some behavior lectures and read some good books. And if you don't know what those good books are, make sure they're positive. If they got clicker training in them, if they've got certain authors in them that are positive trainers, that's a good way to go.
Well, let me ask you this. As veterinarians, should we have those books in our, sometimes, you know, we have our waiting room, and I have People magazine that tells what's going on with Britney Spears this week, but maybe we have more books like that in the office.
Sure. Have Karen Pryor's Don't Shoot the Dog or her new Animal Minds book. Have some books by some of our colleagues who write positive training books. But what I always recommend, Wayne Hunthausen and I did a set of AHA pamphlets, so there's about 14 or 16 pamphlets that you can give on specific topics. Those are veterinary related. Debbie Horowitz and I did a whole CD of Life Learn handouts, and one of the things there is a reading list. You don't actually have to have the books, but if you have a reading list, that helps. And one of my favorite things of all, go home with this principle and you've got it made. Have a website with links, and you make sure those links are to the sites you want your clients to go to. One topic should be behavioral links, and if you don't know where to go to the American Veterinary Society of Animal Behavior online, avsabonline.org, and they have position statements on punishment, on reward training, on dominance and why it's not right, on what wolves really are, families, not packs. You wouldn't believe the information that's out there, but link your clients to those because there's lots of wrong places to find on the web. So website with links.
Repeat that address again for us.
avsabonline.org. You can also learn about veterinary behaviors from dacvb.org, but the position statements are on that American Veterinary Society site. And make good links to your site, and your clients will buy the right books and go to the right places.
Well, I'm glad to hear that. I think it's one of the things that, and I'm perfectly guilty of not doing enough behavioral things in our clinic, mostly because really there's so much information out there. I'm always just afraid I'm going to be in the wrong, make a misstep or say the wrong thing. But
resources. Even the book that Dr. Horowitz wrote has a CD in the back with handouts you can print. The book that I did has a CD in the back with handouts you can print. AHA I mentioned, Life Learn I mentioned. Have things for your clients that aren't just medical or also behavioral. And at every puppy visit, we give a socialization handout, a nipping and biting puppy handout, a house training handout, and a crate training so they get started off right.
We do the same thing. And I got to tell you, I think most clients are more interested in those sorts of things than they are about high antigen mass vaccine and low egg cell passage and all the.
We just tell your clients your vaccines are today. Here's the deworming medicine. Here's the heartworm prevention. Come back next month. Now here's a whole bunch of behavioral issues, especially when they're young puppies. So they'll just listen to you on the medicine. If they have questions, they'll ask you. But you can have that on your website and handouts too.
Sure. Well, good. Yeah. Well, hey, you know what? I really appreciate you coming in today. I think veterinarians probably don't do enough with behavioral medicine, and I think all of us probably get more behavioral questions than we care to think we get. And
if you save that pet's life and if you improve that bond, it's good for you too. So what's good for the pet is good for the vet.
That's right.